Hi, this is Brian Kim. I'm going to share with you case number 156 in the best way to do cataract surgery series. This is a 3 to 4 plus dense lens. And you're going to see slow motion, double chop, cross chop, and detailed explanation of my instrument positioning and where I'm placing it in the eye in order to be able to achieve that double chop and cross chop fracturing, and then successive crushing maneuvers using mechanical fracturing forces to crush the lens pieces into smaller and smaller pieces, and then emulsifying them. By doing it this way, I'm able to reduce ultrasonic energy use, and as a result, achieve clear corneas postoperative day 1. I use a corneal marker, which will help me to center and size a rhexis, and then I'm using a paracentesis blade. In this case, it's a metal blade. Make sure I'm flat to the iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. And then this is the left paracentesis incision. This is intracameral lidocaine, and then some intracameral epinephrine, and then some intracameral dispersive viscoelastic, which will coat the corneal endothelium and also flatten the anterior capsule. And this is a triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel through the cornea, and then when I'm ready, I turn the eye towards me, and then I enter. This is the Hydrodissection forceps, but unfortunately these are the blunt tip ones. You can see I'm pushing, and it's causing quite a bit of stria in the anterior capsule. Probably should have backed off and used a cystotome, but I was able to finally puncture through. Again, with these dense lenses, there's quite a bit of zonular laxity, so I'm not surprised. And so I'm so happy that now I'm using these sharp tip Hydrodissection forceps. There's no traction on the capsular bag or on the zonules when I use that sharp tip Hydrodissection. It just punctures beautifully, just like a cystotome, and then I'm able to use those forceps to go ahead and proceed with the capsulorhexis. As you can see, I'm going around. I have a lot of confidence. It's not radializing, very little OVD egress with this forcep. This is the capsulorhexis hydrodissection technique. I place the cannula under the rhexis edge contra-incisionally, point the tip down, get a nice dissection wave, decompress on the left side, and then I'm turning the cannula to the right side, hooking the peripheral lens, and the lens begins to spin. Irrigating the surface of the eye, adjusting the sleeve, lifting the incision with the chopper, going in with irrigation off to minimize Descemet's trauma, removing the surface epinuclear material, place the chopper underneath the rhexis edge, and this is in slow motion. I'm sliding it, pronating my hand, and then I'm rotating. Now that I'm vertical, but it's slightly pointed towards me with the chopper tip. I point the phaco tip vertically sub-incisionally, bring both instruments together. I'm able to fracture the lens completely in half. I'm separating here. You can see that's full thickness fracture. I rotate and pronate my left hand and slide the chopper underneath the right heminucleus, rotate it back in the vertical position, pull it centrally toward the phaco tip, and then it fractures the lens. Again, the chopper against the phaco tip. Use a little vacuum to pull that first quadrant up, and then crushing the pieces into smaller pieces, using the instruments to crush the lens, and then emulsifying the pieces using a little bit of ultrasonic energy as well as the vacuum. Using the chopper to lift that fragment up out of the bag. Again, when you have a lot of pieces, it's kind of all stuck together, jigsawed together, and pulling the lens pieces up with the chopper is really easy and effective. I'm placing the chopper under the second quadrant. You can see the patient is moving a little bit. I'm just kind of waiting for the patient to settle down, and then I'm able to pull the chopper towards the phaco tip and then crush that second quadrant. I'm getting under the lens fragment with the chopper, fracturing it again, using a little vacuum to lift that fragment up, sandwiching the lens pieces between the instruments, and then emulsifying the lens pieces. You can see that there's quite a bit of density as I'm trying to crush the lens pieces. Using a little bit of vacuum to position that lens piece on the tip, and then crushing the pieces. Turning the second heminucleus in front of me, placing the chopper under the rhexis edge, pulling it centrally toward the phaco tip, fracturing the lens completely in half, prolapsing that third quadrant up, using crushing forces to crush it into smaller and smaller pieces, and then emulsifying the lens pieces. Getting underneath the fourth quadrant with the chopper, pulling it centrally toward the fake tip, again crushing the lens completely in half, and then using crushing forces, crushing the lens pieces into smaller and smaller pieces with the instruments, and then emulsifying the lens piece. This is the last fragment, getting around it with the chopper, again pulling it towards the fake tip and then crushing the lens completely in half. And that's the common maneuver right there, is crushing the lens between the instruments rather than utilizing ultrasonic energy or vacuum to try to hold the lens, sculpt the lens, or anything like that. So I remove the epinuclear material, I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. I like to start sub-incisionally, removing the cortical material from anterior to posterior. Gently sweeping, slightly tangentially to peel off the cortical material. You can see when you do it that way, it just comes out in big, big sheets. Very careful about using the vacuum without going too aggressive there. And then I switch to polish mode and then switch to visco mode. There's a big wad of cortical material. Polishing the posterior capsule as well. Polishing underneath the rhexis edge again. So when you have these big boluses of material on the INA tip, you want to be very gingerly. You can go pedal to the metal, but right when it starts to clear the tip, you really need to put the pedal off and put your foot off so that you don't grab the posterior capsule or anything like that. Thankfully, even if you do with this polymer tip, it's really very safe. So again, very carefully polishing on the posterior capsule surface of any fine lens material there, also polishing in the subincisional area. That subincisional area usually is the area that tends to have that stubborn lens material. I'm going to use a BSS cannula to pulse into the subincisional capsule fornix. Since I'm not able to polish in that area very easily, it goes nice and clean. I'm going to go ahead and inject some cohesive viscoelastic to fill the bag. And this is a capsule sweep. I'm going to go ahead and polish under the rhexis edge. First on the left side and then the right side. You can see this is a really nice big pupil, so I can confidently polish and see everything very clearly there. And this is a single piece acrylic lens. Bevel down, we'll go ahead and inject it into the capsular bag. The leading edge is in the bag. Quickly transition to the INA, go in with irrigation off, activate irrigation, making sure the haptics are off the optic. Going underneath the optic, tilting it and rotating it 90 degrees clockwise, removing all the viscoelastic from within the bag. Repositing the optic back, switching to polish mode, polishing underneath the rhexis edge. Switching to visco mode, removing all the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is a typical 3 to 4 plus dense lens that I see. Thankfully, it wasn't super dense, so I didn't have to do the terminal chop maneuver. This did not have a posterior plate, and as a result, I was able to perform the double chop and cross chop. Again, I'm able to position the instruments around the girth of the lens, and by doing it this way, I'm able to fracture the lens completely in half with fracturing forces. I don't have to sculpt, I don't have to crack from the surface, I don't have to lollipop the lens. It's all with directly using mechanical forces, just sandwiching and crushing the lens with the instruments. To me, this is very intuitive. It makes a lot of sense. And again, as long as you're able to comfortably and confidently place that chopper around the lens along the equatorial side, this really opens up your whole world to a variety of techniques. You're able to pop the lens up out of the bag by hooking the lens with the chopper. You're able to get around the lens with the chopper and then pulling it centrally toward the phaco tip to fracture fragments, again, all in different fracturing directions. You don't have to be along the long axis of your incision. You can chop from a variety of angles. That's why cross chop is so versatile. And as a result, I'm able to disassemble the lens very confidently and easily without any trouble. So I hope this was helpful to you, and I thank you for your attention.